It's all yours.
It's on me?
Yep.
Okay. Hello, everybody. I am Katie Morris Henson, and I am so excited that Jennifer has asked me to do this webinar for you guys today. Just a quick bit about me. My very first clinical role, and I've been doing this a little over 2 decades, was actually as an on-site clinician at an alternative school. And I've continued to pretty much focus my time clinically on, I like the adolescents. I always say the foul-mouthed obstreperous teens are my favorite. But I definitely understand more today than ever over the course of my time in behavioral health that kiddos speak with their behavior, and the onus is on us in all of these different kind of social service roles, whether that's educators or clinicians or child welfare, to kind of do a better job of interpreting that behavior so we can both kind of rein that in and help kiddos manage those emotions and assign some logical learning consequences, but also when the need is pretty evident, how to link them to the services that they most would benefit from. So today is really a kind of 101 primer on what it means to kind of understand through that lens of how kids may be communicating with their behavior that they've had some pretty challenging experiences, and what you guys can do as educators in your various settings to intervene in the most trauma-responsive way. I will say I'm not a huge PowerPoint person, and I am going to try very hard to stay focused on my slides so that I can give you guys the most information possible in this hour. I definitely would love if you ask questions. Probably going to hold off and answer those at the end. And I do want to say I have adapted this training from the National Child Traumatic Stress Network training that I've been doing for years on caring for children who've experienced trauma. Duke University was gracious enough to allow me a code to kind of go in and edit and make this a little more succinct and applicable to educators. You'll notice there may be moments on some of the slides that were added later that language didn't change, but I don't think you'll mind. I just wanted to point it out. So here we go. The thing that I would hope, I don't think alt-ed educators need to hear this as much as maybe your colleagues, that this is really not about, quote unquote, those kids. Oklahoma has a disproportionate number of children statewide. We actually are ranked #1 as a state for children with the highest number of ACEs, or adverse childhood experiences. And collectively what that means is the 4 or more of the 10 that they've identified lead to pretty significant clusters of poor outcomes both in health and behavioral health, education, and kind of social acumen. And so while this may be focused as an alternative ed webinar, these are kiddos that are in every classroom in this state. And the degree to which we can all kind of change that lens that we look at kids and their behaviors through will, I think, probably benefit all kiddos and certainly all your educators' collective sanity, because it would be disingenuous to not admit that it can be a challenge. Kiddos who've been through some really hard experiences can really be challenging, and can we be really frustrated and annoyed and frankly feeling a little helpless, and that is definitely nothing they teach you about in pedagogy class, but you're just supposed to magically, I think, somehow have the all-encompassing knowledge to understand how to meet the social, emotional needs of every single child, and that's not even doable. But I will say this, and as a clinician, I am grateful that I have been exposed to and trained in really quality, evidence-based interventions. But I will also say not every child needs therapy, but every child needs and will benefit from having adults who can just kind of take a deep breath and manage their own emotional response to challenging situations, frustrating kiddos. And that really is kind of the best medicine for helping kiddos adapt those more challenging behavioral responses that you may be seeing in your classroom. That doesn't require a lot of letters after your name. That, I hope, will be something that at the end of this hour you feel like you have some, not just a better understanding, but maybe a couple of concrete ideas and skills that you can practice in those moments. I do think that maybe the most important thing to remember is that trauma, while there are certainly some general events that we can all agree are unpleasant and super rotten, it's the reason we have 9,000 children in child welfare today. And although that number is lower than it's been for a couple of years, about half of them are under the age of 5. I mean, we do not, as a state, do a great job raising other people's children, and yet when we have these kind of fractured systems and there's tremendous financial stressors and the substance use challenges that Oklahoma faces, it really kind of all coalesces often in your classroom. And what's the most important thing to remember is that our opinion of those events, our kind of subjective idea about substance use or corporal punishment or divorce, or what, those aren't actual assessments. That trauma really, at the end of the day, is an event that is specific to that person, that child, and the way they experience that event is so significantly overwhelming that the degree of helplessness and fear, either for themselves or someone else, really gets memorialized in a way that, depending on how that event occurred and how chronic it may become, it begins to really change the way the brain operates and how kiddos learn to respond and feel safe in the world. Certainly there are different types of events, and ACE has talked about 10, and I do want to let y'all know, Jennifer and I were just talking before this, the conversation around adverse childhood experiences and beyond that, the way that the system of education and behavioral health really centers on providers and educators and the impact that has on you guys, the predisposition of secondary trauma on you as a teacher is significant. And we're going to actually spend another training that Jennifer will get in touch with you guys about, related to that connection between the ACEs study, secondary trauma, and the way that could potentially be impacting you as educators and how to ameliorate that in the future. That isn't this, but I did want to say that. Acute traumas, however, might be a one-time event, even a one-time ACEs or a car accident or medical emergency. A chronic trauma might be exposure to community violence or domestic violence. Repeated issues of neglect, which is really the predominant issue that often brings children certainly into state custody, seem more benign on the surface, but actually lots of data tells us that, certainly according to the age of the child, the neglect that they experience can really create some long-term developmental challenges. And as we go through this today, I'll be mentioning that because it has a huge impact on the social and emotional kind of trajectory of kiddos. So you may have a 15-year-old in your class, but the chronological age might not have anything to do with that more social emotional maturity of the kiddo that's sitting in the chair and making you want to go lock yourself in the bathroom and call your principal. So really thinking about how neglect changes the way kiddos think about the world and where they fit in, particularly when the neglect and abuse they're experiencing is at the hands of the very people that one would assume is tasked with protecting them. And there is something particularly painfully damaging about the sorts of trauma and neglect that occurs at the hands of one's parents, and how that begins to look in behaviors, both external behaviors and internalized behaviors, often is those first kind of kind of signs are kiddos figure out how to feel safe, and the way they manage their emotions may be to either completely shut down or to completely become dysregulated. And figuring out what those different types of communication styles are saying about that kiddo and what they need and what's going on, and therefore how to help them self-correct or manage that or link them on to proper services is vital. I do think there is an opportunity, and the rest of this presentation will be about what that really looks like on a physical and physiological level with regard to kind of age breakdowns, but also where you as educators can intervene in a way that not only helps that child, but frankly might actually help more than that child and you, just to stay sane and focused and manage your own kind of emotional response to those scenarios. For me, the best message is that the medicine of a safe adult who can address a behavior without becoming unmoored by it, helping that kiddo figure out a different way to kind of fit into their skin versus immediate expulsion or being told, you're doing it wrong. And I'm 5 or I'm 15 and I know, but you're killing me and you're doing it wrong, so you're not welcome here, is, while understandable, really some of the biggest challenges, certainly on the child welfare side, that we see, because what we know is that for every broken placement, for every school removal, on average that child loses about 6 months of educational progress, and that becomes so cumulative that they often just give up. And so when you begin to see certain signs of hyperarousal, that kind of quickness, that startled reflex when the morning announcements come on, or this real antsiness, maybe it's before a test or when a particular child sits next to them in the lunch line and they begin to over-respond, really begin paying attention to those kind of physical signs of hyperarousal in certain kiddos, and begin to see if you connect that with later or subsequent, I hate this term, but acting out or events that become really disruptive in the classroom. Probably re-experiencing is the one we gloss over the most, but is really significant. We so frequently have our little guys that people are just confident they have ADD or ADHD, and often I always remind people, at least on the clinical side, that symptoms of ADD and ADHD are almost exactly the same as post-traumatic stress disorder in children and young adults, and very, very similar to symptoms of kiddos who have been substance exposed in utero. So it really has to be a psychologist doing very specific scales to determine if a child has ADD or ADHD, or if it possibly is a trauma response or a substance use exposure. And for some of our kiddos, it's often both, all three. But those respond to different interventions, medications, and so really being thoughtful that sometimes those kids that look like they're not paying attention or they're daydreaming, or it's coupled with hyperarousal and they immediately create some chaos, you might begin to tie that to, it was the Thursday announcement, and it's that particular woman on Thursdays who does the morning announcements, that child may not even realize that the reason it's on Thursday morning is that lady sounds like his grandmother, and that's the one who locked him in the closet, or you just don't know, and nor should you be expected to know the trauma history or background of every single child sitting in your class. This is more about being thoughtful that possibly children's motives aren't intentionally malevolent, that there might be something driving a behavior, and to take a step back and dig a little deeper and ask what might that over response or that daydream or that kind of disruptive, chaotic activity be trying to say. Is there some sort of rhythm to that? Is there a routine? Is there a pattern I'm beginning to notice? And then connecting that with that child so they might be able to notice. The worst for me are when we begin using language like good and bad, I become unmoored, as if a child's not bothering me is somehow a barometer of their moral character. And we talk about this a lot in child welfare and in behavioral health. And so I would be remiss to not say it to you as educators that you know better than anyone the importance of language and the power that the words we have and say of and about kiddos has a pretty significant impact, and how we talk about them even behind closed doors becomes how we treat them. Not consciously, I don't believe. No one wakes up as a teacher and is like, can't wait to go be crappy to kids. But we get tired and overwhelmed and really frustrated, and teachers are absolutely suffering, not just from the same fiscal kind of constraints, but significantly more. And plus you house all of our kiddos for 8+ hours a day. So more than anyone, y'all need kind of permission to exhale and grab some language around behavior and permission to try out maybe some different ideas about how to intervene. And I say that to say these kiddos are often more the internalizers, so they may not be on your radar because they're not calling you crazy names and punching Joey and kicking the dog and running out the back door and hooking up with the construction guys in the front, the school smoking weed. Like, they're just the quiet, polite, please don't notice me. I'm just quietly trying to figure out how not to be here anymore or how not to be noticed. And I promise you, in all of our systems, when we're exhausted, it's easy to just be like, thank God, you're not blowing up my day. But they are often the kiddos that we miss that need us the most. And being really attentive, it's one thing to just be quiet or reticent as a child or teen. It is another to realize that that isn't actually that child's normal presentation. And if they're beginning to be avoided, not as engaged, if they're withdrawing or becoming a bit sullen or numb, and that is not the typical way you experience them, I would encourage you to those are kiddos that definitely need us to reach out, because while we won't ever know all of the events and stories, not just that came before, but they're often faced with in the morning before they get there and are so grateful to be at school because they're going right back into them at that last bell. You can't know all that, but you might begin to see some of those responses in the behaviors of lack of concentration, that real labile mood, like super happy-go-lucky, and in 2 seconds, sullen, angry, mad, cussing out the kid next to them, or really falling asleep in class. And when you call them out, you can tell that it's not, it's because you can tell they probably haven't had any sleep, and instead of being angry, really maybe finding a way to have a conversation about what's going on. I can tell you have huge bags, you're 8. 8-year-olds should be getting sleep. Let's talk at lunch. I'm a little worried. But I do need you while you're in here to, maybe I can get you to move around, and finding ways to kind of problem solve, but also dig a little deeper when you have that chance, trying to figure out the root of some of those changes in behavior and reactions that you see. Probably the most common will be those age inappropriate, the ones that make us so frustrated, like, you are 15, you know better, or you're 10, what are you don't act like that. Really, again, instead of kind of being face value and addressing those initial presentations, maybe assigning consequences based on the deeper second question of what might be causing a kiddo that does not typically behave that way to have suddenly done that today, or if that's how they always behave, might they bear some thoughts with regard to their situation at home? Might I reach out to other people who know this kiddo a little better? Are they in services? Are those services useful? It certainly doesn't seem like they are improving in their ability to be attendant to learning in my class. Those questions, our kiddos, those are not clinical questions. Those are just, I'm an adult trying to advocate for the best possible academic experience for the kiddos in my class. And you absolutely cannot do that by yourself or on your own. So while we don't want teachers to suddenly now you have to be therapists, just being able to have a therapeutic lens and ask 1 or 2 slightly deeper questions about the things you see so that you can ferret out who just literally needs to take a deep breath and help you grade papers today, or in my day, they made me go dust erasers, if that tells you how old I am, versus the child that genuinely may have some behavioral health challenges that merit an assessment and possible treatment. With your little ones, you may see that bullying behavior or perseverating on issues or why, and it's easy to get annoyed and frustrated. Some of the other pieces of that we're going to talk developmentally in a minute. But what I want you to know as we go through the rest of this webinar is that, you know, I know we say a lot in my field, you know, kids are resilient. And sometimes I wish we didn't say that, because it gives us permission to, I think, really minimize the impact that this adult world has on little guys. And then we get really frustrated with them that their inability to manage the hard adult realities of this world cause our day to be more challenging than we're often equipped to handle. And I promise you, kids, they do have resiliency. Sometimes the resiliency skills they have are the very things that we find maddening. It's probably why I like those foul-mouthed obstreperous teenagers, because they're survivors. I'm less worried that they're going to commit suicide and more concerned they're going to keep selling drugs and beating up their probation officers. But if I can get them to see those survival skills as an asset, I can help shift the way they operationalize that in a way that creates a much more peaceful life for them. That opportunity to build resilience is uniquely in the hands of educators who are with these kiddos. You have the opportunity to be that medicine far more than I do at an hour a week with one or two kiddos. You guys surround children with your own presence of being one safe adult, maybe the only safe adult in that child's life every day. And I promise you that in and of itself, you don't have to be perfect. You don't have to be error-free. Just being transparent and consistent and psychologically safe for kids will be the #1 resilience building factor most of these kids will ever have. And I cannot say enough that every message you send to children that they are safe in your classroom, they are capable of figuring out how to behave in a way that allows all of the kids there to become much more capable of learning, and that they belong. They are lovable, and they can, by golly, figure out a way to behave in a classroom that allows for everyone to get their academic needs met. It may look different. It may have to have some learning curves built in, but that message becomes the template for how they begin to interact with the rest of the world around them. And nobody has that ability more than you, so God love you. That said, I want you to know that some of those pieces, I was telling Jennifer and Gary this beforehand, I've been doing trauma responsive kind of work for over 15 years, and it is always the #1 red flag that people often get is somehow being trauma-informed or trauma-responsive immediately means there's no rules, no boundaries, bless their little hearts, and they can run hog wild. It is the absolute antithesis of that. Growing resilience within a trauma-responsive framework is absolutely about managing my own response, helping them feel psychologically safe, giving them a sense of agency and autonomy over their own life, and absolutely saying, you belong here. And to belong here and succeed, I appreciate that your backstory makes sitting in a chair for a long time hard, or Mary Sue, she is an unpleasant girl, but you can't punch her in the face every time she makes fun of your outfit. You can figure out a way to be successful in this classroom. I know you're capable. And also there are consequences for when you punch Mary Sue. So you can assign consequences and link that to that sense of community and belongingness. And sometimes I think our systems get so overwhelmed and fractured, not just the educational system, but all of our systems, that we default to expulsion or inpatient psych as if there's nothing in between. And really, those should always be the extremes. Most of the ways we provide supports to kiddos is all of that kind of continuum in the middle of assigning consistent, logical consequences linked to kind of adaptive ways of helping kiddos figure out how to fit into their skin and deal with the effects of their own personal kind of adverse story. And on that note, we'll move on to kind of understanding that better as an educator so that when you see those pieces, it maybe makes a little more sense. Some of you probably already know a lot of this, but I wanted to include these slides because I do think it's important. But when you hear all the time that fight, flight, freeze, it's really the way kind of that lizard brain level keeps us safe. And when we have that chemical release and it's either freeze, maybe the bear won't see you, or run like heck, or take a deep breath and go for it and try to fight, that's in the service of keeping us physically safe and alive. That threat's over and the brain, everything kind of goes back down. But if that threat is continually repeated, if our system as a child or a young adult or a teen kind of just constantly has to stay on alert, alert, danger, danger, what begins to happen is, and it kind of goes back to my opinion of what is considered a trauma, my opinion of your experience is completely that. It is not an assessment, it's just my own personal bias and opinion. The brain's response to that kind of constant state of alert is subjective to each child, and it is often contingent on the degree to which they have built up some of those real internal resiliency skills. When I was a child, when I cried, was I picked up and held? Was I fed? Did people tickle my toes when they changed my diaper? Or did they push me down and have a really mad voice and complain about how expensive diapers were? And I just changed. So then I just learned, don't cry, or I'll just sit. Those kind of templates are all precognitive, but what begins to happen is it creates a response system that sends a message about how safe or unsafe the world is, contingent on those adult caregiver responses. And those templates kind of, it's as if the brain kind of gets wired to expect danger. And while you think to yourself, well, they're not in danger when they're in my classroom, that is not, that is superfluous to the brain response. And how we make memories through our senses, and what we see, what we smell, what we taste, what we hear, that is every child, your perfume, that particular song at the pep rally, that one girl who has the same name as the mean girl that lived next door that did that bad thing. Like, all those little triggers are as if the brain is like this filing cabinet. And every trigger that sends that signal, alert, alert, danger, danger, immediately often throws open that kind of filing cabinet, and those automatic built-in safety responses kind of come cascading down. And the problem then becomes, that's how the brain begins to develop. And as it moves through that kind of primitive basic survival place, up through, I call it the go center, that kind of pre-adolescent, adolescent part of the brain, and then all the way up to that more complex place, that frontal lobe, where we want kids to ultimately kind of develop that ability to have an impulse and not actually act on it, to have some linear thinking, the ability to deal with complexity. You guys don't get the benefit of that because they're all still teens. We know that girls today, we understand that frontal lobe piece is around 22, maybe 24. Boys are 28 to 30. So they are wired to just be constantly trying to figure that stuff out and form connections and have experiences. And my kids get to try stuff, make incredibly crazy mistakes, come back, get some consequences, take a deep breath, and I kick them right back out of the nest to go try that again, because that's how they learn. That is the purpose of adolescence, is to prune, try, and figure out, how do I figure out which decisions are going to resonate with the kind of life I'm trying to build, and what parts of my experience with my caregivers, my adults, my parents am I going to keep with me, and which ones do I kind of prune out because this is a better way, or that didn't work out great for them, I'm going to try that, my teachers. That's just a function of brain maturation. And through that, the problem is often at the same time they're trying to do that, all of those other experiences are continuing. If they're repeated, they're making their own same kind of connections as well, and they become stronger. And what we see with our little guys is that constant exposure to anxiety or fear that really derails proper developmental trajectories, that we begin to see children between the ages of 0 and 4 really sometimes stop making progress through what we would consider to be kind of nationally normed developmental milestones. And in fact, they might often begin to regress. And then you add possible trauma impacts on that. Kiddos who struggle with inflexibility or inability to self-soothe, those become 2-year-olds and 5-year-olds in preschool and kindergarten and 10-year-olds in your fourth grade. And that kind of constant pruning and confirmation bias of world isn't safe, adults can't be trusted, none of that is even necessarily conscious, but it becomes the way kiddos kind of know how to be in the world. And that 0 to 5 range where they should be trying to figure out object permanence and attaching in a healthy way to primary caregivers, you'll often see this real hypersensitivity to noise and maybe even like that startle response we mentioned, real confusion about who's safe, who isn't, maybe really inappropriate gravitation to adults, where adults go, wow, I must be amazing because little Mary just, every time she sees me, climbs into my lap and strokes my face and says I'm not. That's completely inappropriate and not safe behavior, and yet we often will reward that because it feels nice, and it seems, versus the child that kicked you in the shin and called you crazy names and pooped in the closet before they ran out your back door, and now the principal's having to call the police because Johnny, the 4-year-old, just escaped from preschool. And we get mad at that child and don't recognize that both of those children are using their behavior to try to figure out how am I going to be safe. And that is dangerous, because then people like me get involved and start putting labels and diagnoses, and if we don't get those kiddos linked to really good quality providers, well, that's a whole other training. But I'm sure I'm preaching to the choir, because you deal with the sequelae of my field, sometimes best intentions and poorest interventions. Just going to therapy there's nothing magical about just going to therapy. Really being thoughtful about having an assessment that drives what type does a child need, a certain type, what is that diagnosis, and then what sort of intervention might be the most useful to help them figure out a way to kind of be 5 or 15 within the least amount of time possible. For you guys in that elementary setting, although I will say to those of you in middle school and high school, don't forget that chronological age really from this point forward is less important than that social emotional kind of development. So this is for you guys too, that while kiddos in that 6 to 12 range hopefully are beginning to start practicing some of that emotional management, they are still risk-taking, that they're a little, they still don't want to get in trouble, they don't like detention, or they don't want to have their phones taken away. They're beginning to be anxious but still practice socialization. They may be aggressive, but they're able to be kind of redirected. But when you have kiddos who have those real labile emotions or those high lows, you can't even figure out what those triggers are, because they were perfectly fine yesterday or just this morning, and then something must have happened in the bathroom or at lunch, because the kiddo that came back for 4th hour is a different kid, and now the classroom's disruptive, and now they're reverting to these kind of age-inappropriate behaviors. I don't like the term attention seeking. I think we all want attention. Every time I pretend to care about my sweetheart's fishing excursions, I'm really saying, if I pretend to care about fishing, you'll get so excited telling me the story that you will actually make dinner. Like, I get my needs met by giving you attention, and I'm giving you. But kids do that, and we get really mad at them, and I always say it's not so much attention-seeking as please see me and help me understand how to get my needs met in a way that doesn't make all of y'all always get so mad at me, and that I don't have to do these kind of really dire, untenable things to get you to notice me. I tell parents and foster parents and grandparents raising their kids, the best thing you can do is not a timeout unless it's for you. If you're really frustrated, just be honest. I'm about to say bad things. I'm a grown-up. I'm going to go to the bathroom and shut the door because I'm an adult, because I can't take it back. So give me about 3 minutes, and then I'm going to come back because I'm super mad at you. I would go to a timeout, but what kids really need is that time in and that kind of attention-seeking behavior that is so annoying and frustrating to many of us. If you can just lean into that and put them at the front of the classroom and give them those special assignments, and then with no one else around, really talk to them about what is it that you're needing when you start doing those things, and what are healthier, more productive ways that can maybe help you feel that you're good, you're safe here. I see you. I also have 30 other kids I got to be attentive to. So help me help you figure out, because it does make the other kids get annoyed with you, and I know that breaks your heart because you want friends, and that stuff really makes them super not nice to you on the playground. I hear about it. And so those kind of linked, I think, conversations in that age group have a powerful effect. By the time they hit 13 on, where we hope they're doing better at judging danger and modifying behavior, we wish that they were thinking about those long-term goals. We really instead often see this sense of pervasive hopelessness. Why would I even care about algebra? I don't even understand 5th grade math. Didn't you notice on all of my records, I just create chaos so they kick me out? Because A, I would just rather not be in school than to be the dork at the front of the class that still doesn't understand division. And it's more fun to go smoke weed with the older kids in the back than to explain that no one helps me do one of those sentence diagrams that, like, my foster mom has 4 other kids, and she also works. I'm not going to bug her with, could you help me diagram a sentence? I don't even know that she would know what that means. So I would just rather not be made to feel stupid. And it is age appropriate to want to be accepted by your peer group at that age. Unfortunately, for a lot of our kiddos that meet this criteria, what qualifies for acceptance are all of the most maladaptive, self-destructive behaviors that we know as adults include that underestimating danger or long-term consequences that will completely change the trajectory of their lives. And certainly children of color are disproportionately lost in our systems in these ages. We do a abysmal job in my field and in all, I think, social service systems at being honest with ourselves about how quickly we pathologize certain types of kiddos who come from certain types of neighborhoods or cultures with this kind of overarching bias, and it leads to some pretty heartbreaking consequences. I personally, frankly, that's what I love about alternative ed, is my experience for the last 20 years with this system has been that is not how alt ed sees children of any color, of any background, of any challenge, that they are much more open-armed and take a deep breath and how can I help you figure out how to get the heck out of all these systems and go live your life with some paper that says you can get a job. I wish that all of our systems interacted with children that way, but I personally find that alt ed has historically been, in my 20 years in the business, the one system that tends to do that with the least amount of bias. So again, I love you guys. But I hope that for all of the other folks who may ever listen to this, that they think about those kind of maybe unconscious biases or kind of default decisions that they make, and maybe question some of those initial responses before they set kids down a path that it's really hard to get them back from. When we talk about that getting back on track and unlearning some of those old maladaptive patterns and helping kids believe they really can do this and they absolutely can develop more positive skills, a sense of purpose in this world, it takes time. And when we think about how to deal with those behaviors and those feelings, the time it takes is often given 1 hour a week with someone like me, if that kiddo is lucky. And so what I'm about to kind of give you is the quick CBT 101. if all you can do in a moment with a kid is help them kind of understand how what they think controls how they feel, and then based on how they feel, they often immediately make these kind of impulsive behaviors that lead to all kinds of crazy consequences, you will have done them the best service ever. We're all kind of controlled by this unconsciously, and some of us are aware of it and some not. But I used to have duct tape that I would put on the floor, and I would just have kids walk me through. Okay, so you punched Mary Sue, get it. So I get that that was the behavior, but back me up. What were you thinking right before you punched? Well, I was thinking that she was a blankety blank blank, and I hate her. And she, really? Why did you think that? Well, because when I got my tray and I turned around, she was kind of looking at me, and all of the other girls were laughing, and so then I just will physically put them on that kind of duct tape spot. I'm like, so that's what you were thinking. They're laughing at me. That was about me. They hate me. I hate them. Now you're feeling what? I'm feeling embarrassed and ashamed and angry. And then what did you do? I went over and knocked the do-I-diddy out of them. Like, great. And then what happened? All right, now you're in school suspension for 3 days. So unless that was your ultimate goal, then let's figure out a different way. But if that was not your goal, then, and so just that one conversation, if I over and over have that triangle, I will do my fingers in a triangle. And I live in Norman, and kids that I knew at 8, 9, 10 are, you know, now adults and have their own children, and I'll run into them sometimes, and they will do the triangle at me, and I'm just like, yes. It's just a powerful, concrete way to kind of help kids see that connection between what I feel is often because of what I'm thinking, and that leads to me making choices and acting out on behaviors that don't really express a factual scenario, or even if I was right and they were making fun of me, doesn't give me the results that I ultimately want and desire, which is to better control my own emotional responses when I feel scared or overwhelmed, and figure out a way to fit in a little bit better so that all the grown-ups aren't mad at me all the time, and kids aren't just thinking mean to me all the time. The reality is it just feels better to be mad than it does to be sad or scared or ashamed. And adults were the same way. I'd rather just be mad, I can't believe that kid did this, than to just acknowledge that I feel overwhelmed and kind of hopeless myself. When I have a kid that says, what do you mean, get my driver's license? I don't remember the whole algebra thing. I definitely don't care about a license. And like 18 or get a degree, like no one in my family ever graduated high school, or 21. No one in my family even makes it to like 25. So no, I literally don't care about. This is not on my list of the top 3 things I have to worry about today. But thanks for being so worried. You don't have my life. You don't know what I'm going back to. And it feels so hopeless and overwhelming, and it's just easier sometimes, I think, to be mad as a educator or a clinician or a congregate care provider, but that's kind of our kids. It just feels so much more empowering to be mad than to be sad or helpless. And this kind of invisible suitcase of all the experiences they've ever had, and every way that kind of developing brain told them the world was and how they kind of adapted to that. They take that suitcase of feelings and experiences and emotions, whether they're accurate, true, or useful anymore or not, as a way of protecting themselves. And part of helping kind of decipher kids' behavior for yourself is that you then get to kind of transfer and role model that to the kids you work with, really differentiating yourself from other teachers or caregivers, tuning into that emotion that they're having without being overwhelmed or controlled by it, or frankly taking it personally. Setting an example of, I can be mad at you and also care about you. I can be frustrated and not automatically default to shaming you or expelling you. I can encourage you to express the things that are unique and amazing about you, and also correct negative behaviors and inappropriate kind of destructive patterns, because I know that in doing so, I'm helping you develop a sense of agency, that kind of internal locus of control that you will take with you, not just home or into your next classroom, but into the world. And you're going to be working with my daughter and dating my best friend's son, and like going to work at the same place. Like we are in community. This is not those kids and those family. Like, we're all in community together, and being a safe person who can encourage and correct with the least amount of kind of shaming and an over-emotional response on our part is really the best medicine. Don't buy into the stories they tell you about themselves. Try really hard not to respond in anger. Don't take that behavior at face value as if their entire intent was malevolent. I can't wait to come and really make Mrs. Johnson have the crappiest day ever. When we take it personally, we have already lost. We have already lost. Kids by nature are egocentric, but we're supposed to kind of gotten past that. And it's hard because we care about kids or we would not do social service work. And when we get a chance to do the ACEs and kind of secondary trauma self-care piece, I spend a lot of time on this because whether you're an educator or a therapist or a probation officer or a child welfare worker, we are 3 times disproportionately represented in 4 to 6 categories of those 10 ACEs, more than the children and families we're kind of engaging with. So we are absolutely prone to some of the same maladaptive coping strategies. We just happen to actually get a degree in a lot of debt and then go into social service work. But that doesn't mean we have some sort of magic decoder ring about how to manage hard emotions and how to interact when y'all have it in a room full of children. Somehow you're just supposed to magically know how to handle all that and teach algebra and make sure your school testing scores are fabulous. So taking it personally is an easy default, but it is ever and always the first red flag that you probably need a break, because it isn't about you. It affects you, but it isn't about you. And while it's not our job to run in and rescue kids, it's also not our job to get so cynical and self-protective that we forget to just be comfortable with how uncomfortable this work can really be, because it will break your heart. But you will survive it. Every kiddo that is in your classroom that has survived some of the most heinous stories you have ever heard, and many that you probably hope you never do, survived that. You will survive being sad. The bigger piece is, can we find ways to empower kids to not be controlled by that sadness and turning it into madness and anger or complete loss of affect management and that sense of hopelessness? Can we acknowledge and validate, but also help connect to more future-oriented behavior? Can we help them stay right-sized, but at the same time really help them understand this is kind of a big deal? If you can't figure out how to talk about things with words versus fists and behavior, it really just gets harder. And you can do hard things, and my job as the grown-up in your life is to help you figure that piece out. Encourage them when they do it well. There is actual research that just randomly interspersed positive praises, catching kids doing well, is far more significant as a parent and as an educator than one correction. It is the magic of repruning and retraining, because it releases dopamine and endorphins every time. And that is literally rebuilding a different kind of network in the brain. And every time we encourage, when we offer choices, we give kids that sense of agency and autonomy, we're helping them master a skill. And it may seem pretty simple and benign, and it may not be, diagramming a sentence, but it may be that Mary Sue was an unpleasant child at lunch once again, and she isn't likable, but this time you did not punch her. High-five me on that, yay, because you're going to have a million Mary Sues in your life. And you successfully walked away and just muttered what you genuinely thought about her inside, like all of us do when we have to walk by Mary Sue, talk about her in the break room. So those kind, you don't have to tell the kids that, but I'm just saying, like, if those are successes, catching them being capable of operationalizing some of those emotional management pieces. And frankly, I do use humor. Because, good Lord, just being a kid today is already hard and serious enough. I stay age appropriate and kind of stay thoughtful about their developmental kind of acumen, but I definitely pick my battles. Everything is not the hill I want to die on. And being clear and consistent and less personal, focusing on linking those behaviors, thoughts, and feelings for them over and over. I would do the triangle, and they're like, oh my God, I get it. They just begin to articulate it themselves. Done. You have done more therapy for that kid than some of the clinicians they're probably seeing, helping them identify those alternate behaviors, being able to just help them figure out what can they control, what gives their life meaning, what makes them feel a little bit of joy, and I mean finding ways to link and access those opportunities for them. If you begin to see patterns in the hyperarousal, the startle response, when they begin to shut down, when that daydreaming or kind of that lack of engagement is happening, really noticing and maybe tracking that, pointing that out to them, those observations being shared with other teachers or their clinicians. I'm a big believer in those grounding exercises. The SOS, stop, 3 deep breaths. The reason that works is because you can't really multitask. You can't stay in the go center of the brain, the, oh my gosh, and also in that frontal lobe cognitive part. I know people think they multitask. I've always known that I couldn't, but tricking that brain into getting back into the frontal lobe really stops that chemical release of adrenaline and oxytocin, and you're kind of tricking the brain through those deep breaths. And the more of your 5 senses you kind of incorporate, like feel, you know, my allergy nose, that I can hear the rumble of my congestion. I can see my shoulders rise out of the periphery of my vision. If I'm really gross and I want to lick my forefinger when I exhale, I can feel and take. The more of the 5 senses we incorporate into that quick deep breath, the more you've immediately helped trick that child's brain from that, oh my gosh, kick, scream, cuss, run, to the, what? You want me to lick my finger, breathe, that's so cheap. Fine, I did it. And next thing you know, they're kind of focused in that frontal lobe. And at that point, whether you do the 3, 2, 1 or the breathing, if you help them find, again, I use humor and show tunes. I'm the queen of the yodel, the goat herd song from The Sound of Music. I have used that on National Guard soldiers who were about to get arrested, almost 100 of them at Camp Shelby, Mississippi. It takes 3 seconds of yodeling to get a bunch of young soldiers to stop wailing on each other because there's a crazy person yodeling. And but that's not, it's not magic, it's just tricking them out of that crazy ghost center and to stop. It works for everyone, and it's super crazy fast. Those are tricks you could use in your classroom. I guarantee you, at the psychiatric hospital I used to work in, the minute things got chaotic, all I had to do was start singing a show tune or hopping like a bunny, find one kid and use some of those kind of in vivo tricks of, you know, we're definitely going to all go to our rooms now. I'm going to walk like a monster. You are going to hop like a bunny. It becomes the new norm to be like, what does she do? Why is Miss Katie hopping? It takes a heartbeat. But it de-escalates. You're not raising your voice. You guys knew this all along with that whole soft voice, snapping fingers. It's just building on that, but teaching that to kids so they can kind of manage their own kind of emotional response. And honestly, just ever and always reminding yourself, every child is not coming to your classroom with the intent to be oppositional and rebellious and malevolent. They're not all just like geared to make your life crazy and be overly dramatic and reacting and attention. They are just needing a sense of one safe place to be and some sane adults who can take a deep breath and help them manage those emotions. I promise you, as you kind of look through what it means just essentially to do trauma-informed care, you guys, you are advocates. You spend every day trying to look at kids from a more strength-based lens. I only hope that when you're kind of tasked with managing the emotions of more kids than anybody should have in a classroom with more challenges than the state is able to provide accurate and adequate resources for, that you don't yourself give up or think that this effort is hopeless, because I promise you it is not. And every day that you keep showing up It is okay if you get frustrated and mad, and it is okay if you're, wow, you're super sassy and annoyed. I'm going to take a deep breath because I'm the grown-up, but y'all are killing me, so give me a second. Miss Jones is going to come in because I'm going to walk out in the hall, and I'm going to practice my own SOS, and then we're going to come back and all act like we got some sense. I promise you what you've just done is role model that adults can be mad and frustrated and still care about me. They get mad and they come back. They get mad and try something new. It isn't just me that has to try those SOS breathing things. Miss Jones just did it, and it worked for her. Maybe I could try that, and she didn't kick me out, and maybe I can practice. And those messages are the medicine of changing the way kiddos figure out how to be in this world. And you guys knowing that you are appreciated beyond adequate adjectives for what you do is so important to me. I'm excited that we'll get to spend time on that particular take care of yourself, number 9 piece. That whole conversation is the most important piece about the kind of systemic response we all have, because where your role and my role intersect in the life of a child is probably not going to get a lot better as far as the systems of oversight financially and legislatively that control all the things that we're tasked with doing. But what we can do is team together in a useful way to provide a sense of true teamwork. We all have a different role, but we can definitely do better in maximizing the resources we have and help each other take a deep breath and believe that this is work worth doing. And I just appreciate you guys so, so much. And I hope this was helpful, and I'm going to shut up, and hopefully there is an opportunity to answer some questions. I can't believe I actually made it through all the slides, and I didn't curse accidentally, and so Jerry's probably thrilled. And those are resources. She's going to put that online, and yeah, I guess that's, oh, I did want y'all to have this. Oh, Julia. If you don't know Julia Starr, she is the sole person, voice of reason, and educational advocate extraordinaire for all kiddos who may be involved with the child welfare system. She's wicked smart and amazingly adept at helping provide information and resources from IEPs, and I can't even say enough. She would 100% bonk me on the head if I did not provide her information, so that if any of you out there want to reach out to her, she's just an incredible resource to have. So, okay.
No one had any questions. So
okay.
Ask one more time if they've got questions, but nothing came up. So,
okay.
We'll call it good.
All right. Thank you guys so much. Bye.